Right. Hi, everyone. We're going to kick off our December West Coast Mastermind call with our special guests here from the CrossFit Medical Society. We've got Jen Pishko with no voice. She's going to wave and sign to us. And specifically, we're going to be talking about community care, which is sort of what are you saying, like the alternative healthcare? Like almost don't even want to use the word healthcare. And from Jen's team, we've got Grant and Jason that are also hopped on. So they may end up taking the bulk of the questions here to save Jen's voice. But I got to hear Jen and Dr. Tom McCoy speak recently at the affiliate gathering we did up at Craig's place at Diablo. And a few of you were there, which is great to see you guys back on this call again. And I got so excited listening to you guys talk because I knew about it beforehand, but not really to the depth that you guys went into. And I was actually standing nearby Don Fall, and I was just kind of like, this is incredible. He's like, this is incredible. And so we were talking about how we got to get the word out. Also, what I was just telling this group that I didn't know before you guys spoke at the gathering was that there was a bit of incentives for as people sign up, that kind of cash comes back in your pocket, which is another really cool thing, because I didn't even need to be sold on that. If I was in this situation as a trainer, I would have been signing up immediately, just knowing how much I've spent on health insurance through the years. So anyway, I'll hand it to you. And if you want to hand it right to them, because you
I
can't.
will. I do have, let's see. Just a quick situation here. Got so many tabs open.
That's nothing.
Okay. Can you guys see that? Yeah. So just a few slides. I don't want to spend too much time talking not about community care. So we're going to head right to it. And to your point, it is a healthcare solution. Our point, right, and our whole goal was to make the affiliate the health home, right? So that everything can circle around and level and value the affiliate. Grant, I'm going to let you step in there and maybe
Yeah,
talk a little high level numbers down.
yeah. So I think and Katie, thanks for the intro. And Jen, I'm really sorry about this. It just like sounds painful. It's a little painful for us too, but I'm sorry. Um I think when we look at healthcare costs or just look at premium costs for a family of four in the United States today, when I started my career 20 years ago in healthcare, uh the premiums for a family of four was like 10 grand. A little less than that was like $9,500. And today this number's almost $24,000. It's the average just for premiums. This isn't actually procuring care. This is just to have access to care. And so this is, if you're looking at it across HMOs, PPOs, high deductibles, you're really looking at all the same, kind of the same numbers. And I think at some point, the mentality has shifted to like people really reasonably asking the question, do I need health insurance in this traditional model? And community care is kind of the answer to that. Like the answer is no. That this concept behind insurance and traditional insurance being a safety net. There are hundreds of thousands of medical bankruptcies in the United States each year, and the majority of those people were insured, which means they can't afford their deductible. All of their excess flow goes tied up in premiums, and they're either foregoing care or, in this case, so scared of bankruptcy that they're just not getting the care they needed. And so, God, some of these numbers are staggering. But I, when we first kind of jumped into this partnership, so kind of our background, Jason and I were a company called Crowd Health. You can kind of look at Crowd Health out there and see kind of what we've been doing for the last 3 years. But this concept of leveraging community-based funding of medical bills across the community is not a novel concept. You've started to see this in some of the religious circles. You see healthcare sharing ministries. You start to see like health shares, where people are saying, "Hey, listen, like the cost of premiums is too much. Why don't I just procure care when I need it and have a community of people to back it?" And everyone kind of pitches in to pay for those pay for those medical bills. Sorry, Jen, I'm going to go way off script. So
Yeah, that's fine.
I'll
I just
circle
wanted
back
to
to
pull
it.
up, this is what, I'll just put this up here and let you talk
Yeah.
through like the fundamentals.
For sure. Yeah. So the really the basic breakdown, right, is that CommunityCare is backed by thousands of existing members in Crowd Health. We just went over our 10,000th sign up a couple weeks ago. And this is an existing community. So, you know, the CrossFit community is not going to stand on its own, right? But they are part of the broader community as a whole. And the price breakdowns that you see here that Jen has is really kind of a breakdown for the advocacy fee, which is really just access to care advocates, people that help you navigate the healthcare system, and essentially unlimited talk therapy and unlimited virtual care is kind of what the advocacy fee pays for. And then as you procure, you know, healthcare, you're doing all of it inside of the mobile app which for the CrossFit community will launch on January 1st. And then the other piece that you're committing to each month is the crowdfunding, and this is the maximum amount. From 140, 280 to 420 across that middle, that's the max amount for the entirety of 2025. So that is the most we will ever ask you as an individual, as a 55 and over, or a family of 4 ever in a given month. And we've been doing this for 3 years. We've only ever asked for the maximum 2 times in 3 years. The majority of the time it's 110, it's 115, it's 120, but generally the way you can think about it is that we'll only ever ask the members for exactly what's needed to fund the bills that come into the community, period. We're not taking a cut of that. There's nothing, there's no kind of like behind the curtain math on that. This is only what's needed for the community to pay the bills for the month. And then the last piece is important. You could think about this as a deductible, and I hate using it, it's kind of a dirty word, but it's like that. What we ask the member for is a $500 commitment for any event that they have, and an event can be anything from a broken ankle where you go to the hospital, you're admitted, you have surgery, you have medications after the surgery, you have PT after. It's like all of that is one event. It's not like broken up into individual stations of care. And so that's the only thing that we ask members for in that kind of plan year. So if you kind of doing the back of the napkin math, and Jen, I know you had a slide earlier that showed kind of like the cost breakdown as you compare it to traditional insurance. But for most folks, like this is around 50 to 60% reduction in cost to something that's on the premium side. Here, it's a great example. So this is just a breakdown of costs for the year if you're looking at just an individual over the course of a year. So their monthly advocacy fees times 12, their contributions times 140. And again, this is us like being overly conservative here and calling 140 the max, that we'd hit the max 12 months out of the year, which is just never even close to happen. And then to, you know, an annual wellness visit where we cover up to $300 for anything that's preventative. And Jason can kind of step in and help me as we go through this, as he's been on the front end of almost every person that's joined the crowd over the last 3 years. But as you can see here, right, the member commitment's 500 for a car accident, the remainder is crowdfunded. So total cost for a year for an individual is 2,800, which any of these slides can be available. So yeah. Jen, what are the slides you want me to cover?
I think that was really it. I just wanted you guys to be able to talk about how the fees shake out, and then how to think about it over the course of a year and what you can really save.
Yeah. And so, yeah, so really like the big driver here is trying to get people that are small business owners that are young and healthy, that are paying far more into the health insurance system than they'll ever receive in care, an alternative. Because at some point, I think people have kind of reached their breaking point with traditional insurance, and I think we're finally in a place to have a model that's a really strong alternative, and just allows people to invest more in themselves and their families and their kids and real monthly expenses that actually drive value for their family, not in stuff that's, may happen, right? And it's just at this point, I think CommunityCare and our partnership with CrossFit is such a strong example of a group of people that I think are philosophically aligned and are ready to kind of like buck the system a bit and say, you know what, I think there's a different way to do this. Yeah, we're really proud of the partnership. I'd love to answer any questions
Well, you
that
touched a
anyone
little
may
bit
have.
on
Yeah.
the referral piece. Jen's put it in
Yeah.
the chat too, but I don't know if everyone knew about it before you guys spoke at the gathering. I didn't know about it.
Yeah, the referral's just a nice little bonus that we like to give anyone that wants to bring someone else to the program. We've done this traditionally. We've done this throughout all of the crowd, and this has always been a great driver of just word of mouth. It allows us to have people that really believe in the solution kind of bring it to their friends, and essentially that means that if you refer someone and they use your referral code, which will be issued when you sign up, we'll give you $250 if they stay for 3 months. And so on the anniversary, kind of like the beginning of their 4th month, we'll cut you a check and have it drop into your crowd health or your community care account. So Jason, you are so much better at this than me. I'm just the product guy that like builds the applications and like solves problems. Jason's really, really, really good at like, Jason, what did I not touch on, or what do you think I should have touched on that I didn't?
No, I think you've done great. I mean, the only thing I would add there is, as you mentioned, it's the 500 per event, right? And that's where you really save money. I mean, people save a lot of money over the course of the year, but when something does happen, that's huge savings because typically people are saddled with a high deductible, right? Where you're out thousands of dollars, which you might not even want to go into emergency care or emergency room because you don't want to, take that chance of being out. So yeah, the 500 hard stop is very nice. There's no caps to that. We do the preventative care yearly. And then finally is just the telehealth. So that's part of the program as well. So you have unlimited access to a telehealth provider, great for the minor things. If you have an earache or something, you can pop in there 24/7. Those visits are $129 per visit, but those are 100% fully fundable. So essentially free. There's just, you're paying it cash at point of care and then submitting that. So yeah, for the small things, you have the telehealth, no cost. You have the preventative care, and then anything of substance, the most you're out is the 500. So yeah, we try to keep it pretty simple. That's the only option that people have if they were to join.
Can I ask you a
But
question?
yeah. Now,
Yeah.
you guys fire away. That's
Please.
what we're here for sure.
So the question I got from one of my coaches that's actually in the healthcare industry said, "What happens?" He goes, "If I get in a car accident and I'm taken to the hospital, there's an ambulance service, and then I'm taken to the hospital, and then they're demanding payment before services are provided. How does that, when you're talking about a bill that could be, thousands, if not tens of thousands of dollars, how is that handled, at least initially, when you first make contact with the hospital? How does that process take place so that, if I'm only out $500, how do I get through the doors and get care?
Yeah, they can't turn you away. So you're just going in as a cash payer, self-pay. And, something like a car accident, major accidents, they're not even worried about insurance or anything, right? You go through all your care before they even bring that up. But yeah, they cannot deny you for being uninsured, but you're just going in as cash pay. And ERs, they bill after the fact. So you may receive a bill a week later, a month later, 6 months later. As you receive those bills, you just submit them via the app. You're just taking a picture. So yeah, you're not out money. The only times that you're out initially and then waiting for reimbursement, crowdfunding, is for the small visits. So if you're going in for like a preventative care visit or physical therapy appointment, yeah, you're just paying cash at point of care. And then you take a picture of the receipt. It's all app driven. You submit it via the app. And then within 7 to 10 days, it's funded and it's a direct deposit back to you.
Has
So, yeah,
has anybody reported difficulty with getting care or service as a result of not having a traditional insurance company card?
That's kind of what
we,
Eddie was asking as well. Do
Yeah.
people get confused?
yeah,
It's
go ahead, Grant.
yeah, I would say it's a fantastic question. It's like in a previous life, I ran ambulatory groups, and the ambulatory group here in Boulder, where I'm at. It's actually preferred as a provider to see cash pay patients. Your days in AR goes down. You know what you're getting it up front. Every physician's practice and every hospital in the nation has a cash pay or self-pay list. And candidly, it's like I said, it's preferred. I would prefer cash pay patients and self-pay patients to traditional insurance. Not to mention all of the hassles of going through prior authorizations or resubmissions of billing just to get paid. That aside, it's just the days in AR, like you look at days in accounts receivable going from 0 essentially, right? If you're getting paid at the point of service to like 45 to 50, right? So for me, I'm looking at financially speaking, like cash pay is far preferred to self-pay or to insurance.
Those are good answers. Thank you.
Yeah, no problem. And I think one of the things that we don't talk a lot about is that as part of the advocacy fee, the CrossFit community has assigned a care advocate that helps them navigate care. So it's trying to find good cash pay friendly providers, and they work with our members to get them to the right place. And secondarily, when people receive emergent care that's unexpected, we have a team of attorneys and billing analysts on the back end that will help get a fair price, even if you didn't, you didn't choose to have an emergent situation, right? But we can choose and essentially find the right amount to be paying that's not exorbitant, which is primarily what you see from emergency room admissions. Is you're getting something that's 400, 500, 600% more than what Medicare pays for commercial insurance or self-pay. So we kind of have you covered on the front and the back, which is the intent. So any other questions?
Jen's kind of putting in the chat her experience that she actually mentioned when we were at Diablo, where she had to take her son in to get x-ray. So if anyone's not reading in the chat, she's kind of explaining that just to save her voice, just to get a little bit of a, no, you're good, about how it worked being as a cash pay. Teddy, I know you were out there, so you heard her talk about that firsthand, but
yeah, how do I sign up?
Asking how to sign up.
Yeah, I think it's really, the CrossFit Medical Society website and CommunityCare, and there's an enrollment page, and you go through a series of questions and just kind of get all the information from you and get you in. We do see people on the dual coverage side, so we can put it, we'll drop a link to that. Sorry, on the sign up, we'll drop a link to the sign up, and then Jason also has a Calendly link for people that are interested and they just want to go and have 15 minutes to just explore this further in a personal level. Jason will sit there and talk to you. I see his calendar. It's pretty crazy this time of year. So, but you'll be able to pick a time that works for you. The dual coverage is a fantastic question. Economically speaking, there's a window. You can almost think of like the kind of like donut hole coverage for Medicare Part D, which is the prescription drug option. But like there's this like little window of coverage where dual coverage works. I don't know that I'd recommend it only because I don't think keeping traditional insurance, even with the highest of high deductible health plans, is worth it, because we're essentially the same safety net. But if you had employer sponsored insurance that was covering 100% of your premiums, and you wanted to leverage CommunityCare as a way to like get through your deductible, like there's options there. But really then you're talking about the difference between the member commitment and your deductible. So you have to find this like really nice window where, oh, it's an $8,000 expense and I have an $8,500 deductible, and I'm going to use this to kind of cover that $7,500 gap. Like, you kind of have to have this perfect confluence of events to have that be a really, really, really strong option. So yes, you do have an insurance mandate in the state of California, and I could send you a link to exactly what everyone pays based on your income and based on everything else, that you could go in and look in. And I think it's less than $1,000 per individual. And no, that's just in the state of California. Now, well, there's 4 other states that's applicable to, but I can post those here as well. No, there's not a nationwide insurance mandate, not anymore.
Yeah, a lot of times in California, we had a lot of members that reside in California because the savings from switching to us outweigh the actual penalty. So it's just a numbers game. But like Grant said, he'll send you the calculator that you can throw in your income, and it'll spit out what the penalty may be.
Yeah, I know several people on this call are California, so that's helpful to hear. What else? What else? Do you guys have a timeline yet of when it's going to trickle down to members, or is that more based on the success of how it goes right now? Level?
Fantastic question, Katie. So I think we'll be looking to do as soon as possible. But a lot of the idea here is to leverage the success stories of what we have in this initial kind of cohort. But I think 2025 is a very safe bet.
That's cool.
Early 2025.
Amanda's got a half a dozen waiting. That's great.
There's the healthcare estimator for it's just through their tax site.
Did you talk about how we set ourselves up as a referral source?
So
Yeah,
asking that question slightly. Oh, go ahead, Jason. Go ahead.
Yeah, you'd have to be a member. And then once you're a member, you'll have a referral code.
Okay.
And a link that you can share with people that are interested. And if they sign up, they'd have to be a member for at least 3 months, and then you get $250 cash for each member, for each primary that signs up. So yeah, it'll be after you sign up, you'll have access to that.
Okay. Great.
I also thought it was helpful to hear a little bit of a rundown that I forget if it was Jen or if Tom was saying it, but there was a little bit of discussion about pre-existing conditions and how that comes into play. It was helpful for me to hear, if you don't mind.
Yeah, limitation there. So pre-existing conditions, you can join with pre-existing conditions. There's just no funding for any expenses related to pre-existing conditions in the first 2 years of membership. So waiting period there, year 3 and beyond, up to $25,000 can be funded per pre-existing condition. So still limitations, but it opens up. That's the biggest question I get, are pre-existing conditions. So the language behind pre-existing would be anything that has been diagnosed, treated in the last 5 years. So we only go back 5 years. And this isn't an acute situation. So if you had, kidney stones in the past and you have them again, that's not pre-existing, right? It has to be something chronic or like an ongoing injury prior to joining. So, if you have arthritis or diabetes, if you injure yourself and need shoulder surgery, you can't join us and expect that to be funded right away. And then the 2 outliners that we do not consider pre-existing would be high blood pressure and high cholesterol. So, if you joined with high blood pressure and had a stroke and that was attributed to the high blood pressure, that would be eligible for funding, no limitations there.
I think initially that can be off-putting for anyone that's experiencing that, but the explanation that I heard, it was understandable that you guys don't want, because you're trying to protect the crowd that is funding it from anyone that might hop on just to get a quick deal.
Yeah, for sure. Yeah. And we're not a good fit for everyone. We don't intend to be. So, typically people with those major pre-existing conditions are not joining because of that. Or that's where we have a very small percentage, as Grant mentioned, that combine us with traditional health insurance, very small percentage. But sometimes they do, because they do have potential pre-existing major expenses related to pre-existing conditions. So they just, throw expenses towards their traditional model.
One of the questions that was asked by someone in my community was they doubted that the crowd care funds could cover someone within the community that had a major long-lasting ICU stay or something like that, where it's, where you're talking hundreds of thousands of dollars. Have you had any claims like that, or do you think that that's an issue that could break the bank, if you will?
So the short answer to that question is we've had quite a few incidents of long ICU stays, longer treatments with cancer, large accidents, things that have cost the crowd hundreds of thousands of dollars. And you got to think that the distribution of that amount over, let's say, 5 or 6 or 7,000 people is actually like not a really large number when you're breaking it down monthly. And so that's why we can commit and kind of project a year out in advance of kind of what our max crowdfunding is going to be. So what you saw on that page is the max crowdfunding amounts for 2025 in its entirety. So we'll never go higher than that crowdfunding max. And that's based on all of the things that we've seen in the crowd this year. And so we're kind of using our data this year to project forward. And like I said, we've had all of those events, really large events, and we've still only asked for the max 2 times in 36 months, or a little more than 36 months. But the power of a community is really strong, and the power of people that know healthcare and how to navigate it, but then also what a fair price for care is it kind of makes that community stronger. So I hope that was a sufficient answer. I wasn't trying to shut it down,
that was. Thank you very much.
Oh yeah, and I was actually going to ask this too, Jen, just through in the chat about how you negotiate and like how if someone walks in with traditional insurance, how that ICU stay is going to quickly become hundreds of thousands of dollars compared to if this is a cash pay patient, and the negotiation process that happens on your end. If you could kind of outline how it may not be the same dollar amount.
Yeah, no, it's definitely not. I mean, it's I think the big delta that people like when you think about insurance, broadly speaking, you think about Medicare and the Medicare rate, and then everything else is a percentage of Medicare. And so you think about Medicare as the baseline. It's like one of the lower payers, even though Medicaid's lower, kind of use Medicare as the baseline. Well, that's also kind of where you start to think about the self-pay and cash pay line as well. And you can see commercial insurance at 300%, 400%, 500% of Medicare. And that's just a contracted rate. That's literally what commercial insurers negotiate with hospitals and health systems to pay. And that's where we're always in between those numbers. And I'd love to have Medicare rates. We're not there yet. We'll get there. But from a self-pay perspective and cash pay perspective, we've got a lot of leverage. And we also know that charging an individual 500% of Medicare is just not something that we're gonna be aligned to. And we have leverage, and we also have the right people who've been in this system or been in systems like this for a really long time to help negotiate, including a team of attorneys as well. So we're there to go to bat for the crowd, for the individual, and for the long-term sustainability of this model. So it's a fun ride, I will say.
Are you guys on the negotiating team, or is that a different?
No, that's different. Yeah.
Yeah,
Yeah.
yeah. I have a few of those folks, the attorneys that are on my team. That was we have not only our internal team, but we have other external third parties that we leverage as well. So especially when we get into medical necessity, and generally speaking, you can assume that almost any large bill that comes across, there's at least one fairly sizable error in that billing. And so we kind of attack all of these things from a bunch of different angles, including price and quality of care and necessity as well. So
Yeah. Yeah. And I always tell people too, I mean, we do negotiate on the members' behalf, right? They don't have to worry about that. Yeah, don't worry about negotiation. It does not affect funding. It's just for the betterment of the community. So yeah, it's just a nice
Not a
way to keep it sustainable.
yeah.
There was also what was the mention that I was just thinking of? I talked about it before everyone else came on the call, which was, the funding. So Jen mentioned right out the bat, as we were just kind of talking the beginnings of this and how it starts and how you're going to go, get your procedure and you're going to get reimbursed. Wasn't there a situation, and maybe I made this up, where if you knew a procedure was coming far enough in advance, the funding gets raised, given to you prior to the procedure? I see you guys nodding. So if you could kind of touch on that, and how sometimes you may not need to pay out of your pocket and then get reimbursed.
Yeah. And Jason, clean up anything that I screw up here. But the mentality there is that if we have the care advocates for a really good reason, and they're within reach of your phone to be able to communicate with them. So anytime something's coming, we really ask that you're engaging your care advocate that can help you find and negotiate those prices beforehand, and we will 100% crowdfund the amount that's required for that procedure beforehand. Unless you want the credit card miles and you want to put on that's fine too. But like, the mentality would be that you have that money waiting for you the date of service. That's not something that we ask the members to kind of float. So it's a really nice way to help folks that are kind of detaching from the traditional system. It's almost like this concierge model of like being able to talk to someone that knows their way around, and can help you kind of find the right station of care, the right price, get it funded, and have you in and out. So that's the hope. We can make this, yeah.
What other questions do you guys have? Just typing some more. Perfect. And I know there's different tiers, like you guys were talking about individual versus family, but then also I think at a certain age bracket, it jumps a little bit as well, depending on.
Yeah. 2 price points for individuals. Anyone that's 54 years of age and below would be up to the 195. And then once you turn 55, it's up to 335. So a little bit of a jump there. But when you have a family of 4, we don't look at age. So it just cancels it out. It just has the family plan pricing. So.
Okay. And I know Jen was saying, as an affiliate owner, I don't know if you guys caught that in the chat earlier, that she pays, that fee is the one that you're referencing in the chat, right, Jen? You can just nod. And that's the fee she covers for her coaches that kind of incentivizes them to join this. Excuse me. And she was saying it's kind of equivalent to the amount of coffee she would buy in a month anyway, or whatever it was. And that's kind of like her paying their benefits coming from their employer, I believe, if I'm not. Okay. So there's another idea as owners, if you're interested. Do we present an insurance card when we go for a medical visit, or just say that we are cash pay? That's the question.
Yeah, always cash pay, just cash pay, self-pay, cash pay.
Does that raise a lot of eyebrows? I've never said that before, and it sounds scary.
Weird.
Do they you funny? Like, do they laugh, or I mean, what if they say no? I'm kind of nervous. And we talked about that at a time, I know, but
yeah, as Grant mentioned earlier, it's welcoming. Like, they don't have to go they don't have to go through insurance and wait months for reimbursement, all the admin work involved. So it's true patient to provider transaction, right? So they get paid on the spot. So yeah, it's quite welcoming.
In other industries, I feel like I always get a smile, right? If I go to the mechanic and I say I'm cash pay, they're like, great, I'm going to take some money off, right? But when I go to, I don't know, the doctor, it feels like I could throw them off. Teddy's got a question.
I think that kind of on that, I know the ERs here from experience, even if you have insurance, you walk in and you're seen, they walk into your room and hand you a bill. So I think that when we say that we're going to be cash pay, I've had a $4,000 bill handed to me while my husband's having a procedure done for his tonsils. So I think that like that's where I'm worried, is because even going into the ER, somebody's coming into a room and saying, this is how much you're going to owe today before you leave.
Right.
Yeah.
Yeah.
So go ahead, Jason, if you'd like.
I was gonna say
I'm happy to take
we've
this
not
in
had
too.
that experience. They might have you pay some percentage of what the bill may be, but from member experience and myself, I went to the ER. I'm stubborn. I never go to the doctor, but I ended up in the ER this summer, and it was kind of nice for that experience to see, hey, this is how it works, right? They didn't blink an eye. Like I didn't receive a bill there at all. It was mailed to me later. But yeah, even if they give you a bill, like that's not required to pay. It's just a bill. Like if you can't pay 4,000, you can't pay 4,000, right? They might have you put a percentage down on a credit card. But even with our crowdfunding, if it is thrown on a credit card, this is not taking months for you to get those funds back. Like we have a 7-day to 10-day turnaround where those funds are direct deposited to you, and then it's your responsibility to pay the provider directly. So it is a very quick process.
With incidents like Teddy just mentioned, if they walk in with that $4,000 bill, the procedure is literally happening in the next room, maybe. Is that something that she could then take to her care advisor? Is that what you called them? And they could try the negotiating process post procedure, or is that like, well, they gave her the bill and the procedure already happened?
Yeah.
Negotiating.
It's always post. Yeah, post is, we dig into that. So those bills, my ER visit was,
down.
yeah, my visit was I was in there for 3 hours and it was $14,000. I got a bill. I ended up being as cash payer. It ended up being 2,500. Just eye opening, right? Like crazy. But yeah, we do post negotiation as well. So they're just throwing numbers at you, seeing what
If I
sticks.
was panicking in that moment, I feel like I would want, like, from the handing me the bill, I would want to call my community care advisor right then, kind of freaked out a little bit. And I don't know if that's kind of how it works. If they'd be like, oh yeah, we'll get on it. Don't worry about it. Don't give them anything right now, or give them the minimum that they asked for, or that kind of a thing.
Yeah, that's totally, that is the intent of the care advocate as concierge. The other piece is like we instruct all of our folks, if they're receiving emergent care, that like to put the invoice in the mail. Like there's no obligation in any hospital in the United States that you're paying anything before you leave. Like that's just not, it's not a real thing. But the idea, if you're taking the hospital's perspective, for a cash pay patient, if you leave the hospital without paying anything, the expectation is that they will receive less than 5% of the total bill charges if you leave the hospital without paying anything. So their incentive is to get you to pay something, anything, while you're still there. And that's why you see that kind of like high pressure sales, like you're getting sold a car or something. It's like, hey man, listen, like put it in the mail. I'm emotionally distraught. It's inappropriate that you're talking to me right now about this in an emergency visit. Like put the invoice in the mail and we'll take care of it. We're self-pay. And that's when you log an event in the app and you attach the bill and we handle the rest.
I know if anyone has to go early, that's totally fine. I have some other questions I remember that came up while we were at the meeting that I'll just throw on since we're recording this. Was people asked about things like dental and vision. And I think that fell into this other category of like kind of the general spending where you can choose to allocate your monthly spending toward that if you wanted. Was that kind of one way to think of it?
Yeah, you essentially
dental plan or vision plan, like you're given this amount. If you want to just kind of how people could fit that in, touch on that.
Yeah. Typically people go once a year for like your general checkup, right? Some sort of preventative care visit. So we allow members to submit up to $300 per year for a preventative care visit. And so we honestly don't care how our members use that as far as preventative care. We do have some members that use that for a dental cleaning and x-ray or a vision exam or physical blood work, right? Whatever you want to use it for. Outside of the dental preventative care, if you elect to use it for that, there is no funding for any dental expenses. So if you have a cavity or, dental work, that would just be out of pocket, unless you have a traditional dental insurance that you can combine with us.
That's what I thought. And
Yep.
then Beth had put a question in the chat. I don't know if you guys are able to read and touch on that about her specific health issue.
Yeah, there would be no funding for anything related to your left hip. So any expenses there would be out of pocket for the first 2 years of membership.
Perfect.
I think Jen mentioned just the bottom, something that we're doing just for community care is that CFMS biomarker blood panel. You can do one of those every year and have it be crowdfunded as well. So if
Yeah,
that's
on top of
something,
the preventative.
yeah.
Sorry,
So
Grant.
that's no, yeah, that's right. Yeah, in addition to the 300. So
Beth, were you asking about the biomarker blood panel? Do you guys mind touching on that a little bit?
yeah,
Jen's really dying to talk right now. She's like,
yeah.
I have all the answers. Thanks, Kelly. Kelly might have to take off. Thanks for coming on the call. Yeah, so if you guys don't mind touching a little bit on the biomarker panel, that's listed as on the CrossFit Medical Society membership page, I believe. If you guys have it, and Jen just dropped the link in the chat, Beth.
So take a look at that link. It lists out all the biomarkers, all the panels. It's direct to consumer. You buy it, you go to LabCorp, you get it done, you get the results. Whatever you want to do with it is up to you. If you want to use your providers, that's fine, but that's included.
Yeah, this would be like a fantastic thing to take to a functional med physician or like a really dynamite PCP if wants to talk about diet and kind of like how to kind of move some of these numbers. It was an insanely big panel, and generally like you see panels like this in like the $400 to $500 range. And so the price point is pretty crazy. Love to know how Tom and Jen got that price, but they're not going to tell me. So it's like they got dirt on somebody, but yeah, like it's a fantastic deal. So it's a really, really, really easy thing for us to put into this community and say like, go get it done. Let's crowdfund it. So.
And this is unrelated, but totally related. While we've got a bunch of affiliate owners on the call, there is no cost to affiliate owners to join the CrossFit Medical Society. So get on that, go on that website, join. We want to get as many affiliate owners as possible to sign up for that. You'll get in on the newsletter. And then if you do have any, it's not just physicians, is it anyone in the medical community that goes, as members of your gym or coaches that are, please invite them to sign up. There would be a fee for them to sign up because they would have access to continuing education essentially through different types of they like do a grand rounds calls and things like that. So the reason they're paying is that they get a benefit to their profession. So, but please do encourage them, because the more people that in the medical community that are doing CrossFit and advocate for, this lifestyle that we can get to join the CrossFit Medical Society, the better. So I'll just give Jen's little pitch there. Probably not as good as she could have, but while you're all here, everybody go sign up for the Medical Society, regardless of whether or not you're going to sign up for community care. Question Beth had was coaches must have a level 1 for this insurance. At this point, I believe that's the requirement until, as they said, maybe in 2025, it'll be opened up to members where that will not be required. Level 1 or higher, yes. Josh is signing up now. Awesome. Josh down in Anaheim, right on. Love it.
Teddy had a question about how do we see a list of providers? So yeah, Teddy, there is no network, which is nice. So super flexible. Like you go to any provider of your choice. We can also help with that. We have a lot of members that join that have established physicians that continue to to use them. But, you know, if you're looking for a specialist or primary care, we can help with that as well. But yeah, there's no network.
We do have a list of CrossFit Medical Society providers once you're in. So once you're signed up, those are physicians and providers that are part of the medical society. So that is what I was hoping we could kind of preserve from what was once happening years ago. What Coach Glassman was kind of starting up with the level ones that he was offering to medical providers. And we had this sort of database. It was almost like you could search on the map. Where is there a physician that has their level one? It just sounded like a really cool database to have. So it's almost like we're rebuilding that and reconnecting. So you can, I don't know about if anyone has ever worked with a member that has had a bad experience with a medical provider and given advice that is maybe contradictory to some of the advice that you may be giving them about their lifestyle. I've experienced that as well. And I wanted to be able to give them another option of just, you know, second opinion, get another person's advice before you immediately go on the medication or go get bariatric surgery or whatever it may be. Not me trying to give them advice, but rather get them another provider that could give them perspective. So, and I've had owners and coaches reach out to me and say, gosh, I wish there was a database of doctors that get it. So, talk to Jen if you need that. Well, don't talk to her, email her. Yeah, they were the founding group in the directory, those perfect. And I know a lot of our CrossFit Medical Society providers would love to get paid cash and treat fellow CrossFitters. Perfect. Well, I'll start a little wrap up, but if anyone else has questions, throw your hand up or come off mute. But I'm so thankful you guys took the time to step away. I know you had office hours kind of at the same time. So thank you for coming on and talking with us. I'm going to throw this link or this call up on YouTube and blast it out to our team of affiliate owners on the West Coast so they can watch this. And I'll include these links that you put in the chat. So if anyone's listening to this now, I have the links listed below.
Thank you so much, you guys.
Thank you, guys.
Thank you.
Bye. Oh, awesome, Beth. Just saw you said you joined the society. That's great.
Hey, Katie, I'm going to throw my Calendly link in
Oh,
the
great.
chat real quick. Let me, it's on this, hopefully I'll find it here quickly. It's just on a different.
Great, Beth. That's awesome. If you have any questions and can't, you know, don't know, didn't grab some of these links, reach out to me. I'll get you in contact with everybody. That's awesome. I know I wish I would have had this when I was working as a trainer and an affiliate, paying all my insurance. All right, there it is.
All right,
Thank
there's
you.
my, yeah. So just share that. They can schedule calls there, but I back up pretty quickly. But yeah, just throw in. It's a super laid back call. But all right, I'm going to take off.
All right, thank you so much.
All right, see you
Bye.
guys.